According to the American Academy of Pediatrics, about 3,500 infants die annually in the United States from sleep-related issues, including sudden infant death syndrome. It's a terrifying situation for parents because there are so many unknowns and questions surrounding SIDS. Doctors do know creating a safe sleep environment for your baby can help reduce the risk. For first-time parents, sleep is hard to come by.
We're in 3-hour increments right now.
As parents leave the hospital and newborns settle in at home, doctors warn of the risks of sudden infant death syndrome. SIDS is defined as the unexplained death of a seemingly healthy baby less than a year old. It happens without warning, usually during sleep. The exact cause is unknown, but researchers with the American Academy of Pediatrics say one thing new parents can control is their baby's sleep environment, removing anything around that could obstruct the baby's breathing. That means keep the crib bare. No bumpers, blankets, or stuffed animals inside.
Babies really should be in a soft, flat surface with just a tight-fitted sheet. We want them on their backs. Back is best.
Look around online, in stores, or even on TV, and that's not what you often see.
When we were first designing the nursery, I had a bunch of ideas, and of course I was on Pinterest all the time. But when you're decorating the crib, they have animals in there, they have quilts hanging from the sides, bumpers, so all of that is really pretty, and of course you get your heart set on those things. And then when you get home, really it's just a sheet and the mattress.
We've recently been looking at magazines and trying to see, does anybody show a safe sleep environment to parents? Nowhere. Nowhere can you say, oh, that's what my nursery should look like.
And doctors say don't even worry about the nursery to begin with. For at least the first 6 months, babies should sleep in the same room as their parents, in a crib or pack and play.
The research says if the baby is in your room, not in your bed, but in your room, that seems that you are aware of their breathing pattern, you hear them starting to rustle and move in their sleep cycles, and also some even concerns and issues about, do they hear your breathing and is that helping for stability? And we know that if you put them to bed with a pacifier, that seems to regulate their heartbeat, work on their breathing, and not that you're putting it back in and out all night, but put them to bed with a pacifier after they're about 3 to 4 weeks when you've got breastfeeding established.
St. Luke's reaches out to parents in birth classes, and every newborn is sent home in a sleeper sack.
And zips up so it stays securely on them.
A way for babies to stay warm without a loose blanket in the crib.
Think about, sort of that 68 to 70 degrees and think about, sort of like one light item. So you put them in a onesie, a light little, sleeper, and then put them inside a sleeper sack. And you want to watch the babies don't get overheated. I mean, you can walk in and see that they're hot and they're sweaty and, they don't need a 78-degree room.
Also, parents, if you're feeling sleepy while holding your baby, be extra cautious.
Don't go to sleep with your baby in the recliner. You're tired, you're exhausted, you've fed your baby, you're laying there in the recliner, you're thinking, I'm just giving skin to skin, it's great. Recliners have big pockets, easy for babies to roll off. We sometimes think, oh, my bed is safe. Well, our beds frequently have duvet comforters, lots of pillows, they're water beds, and all of those are really hard sleep environments if little ones get over and get that air trapped and they can't breathe.
Doctors say, as a parent, be an advocate for your child and force the safe sleep guidelines in your own home and outside the home at your child care provider, too. So again, a few things doctors say to keep in mind: that bare, empty crib with only a fitted sheet, no extra blankets or stuffed animals. Keep that crib or pack and play in the room with you while the baby is sleeping at night, and keep babies away from secondhand smoke, alcohol, and drugs. And if you're set on decorating that perfect nursery instead of spending money on the crib, Brooke says she chose more artwork and rugs and a cute bed skirt to brighten up the room. So there's an idea for you.